We can start. All right, we are on vote 7 for the Department of Health. Once more, honorable members, welcome back. We are now going for Department of Health. MEC, Honorable MEC Makujwa, HOD, and your entire team, you are most welcome into this portfolio committee. We are very exhausted. We've been here since last week. This portfolio committee is very heavy. You start from Scopa. You finish Scopa immediately. You come to finance. It's a full-time job. So these members have been here. So we appreciate your consistency. So you are most welcome, Honorable MEC and your team. And of course, we have adopted our agenda, but we'll give you to do remarks, and then we'll give the department HOD to do the presentation. Of course, the HOD will decide whether it delegate that responsibility, and then we'll have a discussion, close our meeting. Should not be very, very, very long. So thank you so much for coming through. Honorable MEC, we know your schedule, in particular with the presence and the visit from the NCOP program, but you've made it a point that you come to be part and parcel of this portfolio committee. We really appreciate that. We know the schedule that this week is very tight. So we'll give it to you. It's going to be in your discretion on the amount of time you want. Over to you, Honorable MEC.
Thank you very much, Honorable Chair. Good morning, Chair, and good morning to all the members in the meeting. I will not be very long, Chair. I have a bit of a cold, so my voice will keep on fluctuating. Chair, I think I just want to speak to a few issues. As you know, we are on midterm, and we are here to advise the members on how far we are on the programs, and I'll leave that to the HOD. There are two issues, though, that I would like to speak to, Chair. The first one is the allocation that was promised by the National Minister of Finance early in the year. We did not receive that amount early on, Chair, and it took some time. I think you would have heard the minister, I think last week, indicating how the money was going to be allocated. And subsequent to that, as a province, we needed to wait for our own Minister of Health to indicate how the monies will be allocated. We have subsequently been informed that out of the whole allocation that comes from national, we will receive 1.39 something million, but we round it off to 1.4 billion rands, Chair. So that's how much we will get. According to the Minister of Health, that amount must go, one, to the employment of health workers, which will include it includes nurses, doctors, any other allied workers that we might need to employ. It secondly has to go to the employment of CHWs, because as members are aware, there is a court case that was won by the unions to say CHWs must now be employed permanently. We couldn't implement that decision until we received monies from national. So Minister has indicated that these monies should be utilized towards that. As a province, we have about 9,800 community health workers. However, we are now only going to be able to employ full-time 5,900, because those are the only ones that have matric, and according to the criteria that was set at national, only those that have a matric will be employed full-time. The others, meaning the 4,000 and some odd numbers from us, will not lose employment, but will continue to be paid in the same manner that we have been paying them, except they will receive an added amount of 1,000 rands as per agreement according to the unions and national departments. So this 1.4 billion then speaks to the CHWs that are going to be employed. We are waiting for an implementation agreement now between the National Department of Health and the unions before we are able to put them into the system. However, we are ready. We have been ready for quite a while to employ the SHW's chair, primarily because they are very essential to our primary health care to our system of primary health care. The other amount that we are supposed to be utilizing, or the other part that we are supposed to be utilizing these funds for, is paying off accruals. So whatever will be left after we have paid the CHWs and have employed the healthcare professionals, we will then pay off a part of our accruals or towards our accruals. Minister has also indicated that from that amount, we should be able to employ registrars as well, because registrars chair is a system of training where you train doctors to become specialists. And although we've been doing it, but we've been doing that at a very minimal scale because of our funds. So we are then going to be sharing what is left between accruals and the employment of new registrars. We are hoping that we might be able to employ about 20 new registrars into the system, depending on how much is left from them. The second and last point that I wanted to raise, Chair, is the matter of 200 million rands that we received from the disaster fund. We received the amounts, the money last week, and indication came last week that that's how much we will be getting. Unfortunately, because it is monies that we had not planned for and no one had indicated that we would be getting these funds, we had not had a proper plan. However, Chair, remember, these disaster funds are disasters that happened in 2021, 2022, and we do have a number of projects that were already in the pipeline that we were going to fund from our own equitable share. So this disaster fund will alleviate some of the pressures from that angle. The last point I wanted to raise, Chair, is the matter of 154 million rands that we will be receiving from Treasury and coming from other from other departments. We appreciate the monies that the Executive Council decided to reallocate to us to employ doctors and nurses in particular, Chair. We are a bit worried, though, because we have not received an indication of a carry-through, because there will be carry-through costs, but we've not necessarily received an indication of what's going to happen in the outer years. However, we appreciate that allocation, and it is what we are going to be utilizing to employ the 120 doctors that we have advertised for. I just thought, Chair, let me speak to those, and then I will hand over to the HOD to lead. Thank you, Chair.
Thank you, MEC. Good morning, Honorable Chair and Honorable members. Maybe just to add a few things on what MEC has just said is that Honorable members, maybe they would come across this, that in addition from that allocation of 1.4 billion, we had to allocate funding for the employment of medical interns and community service doctors, which are statutory appointments that we are supposed to employ. And therefore, part of the budgets for accruals that we had used towards accruals and to the procurement of beds and linen has now gone towards the employment of medical interns and com serves. One felt that it's important to raise this because honorable members may get it that other provinces are procuring bed and linen, and we as KZN have not done that. It is for the simple reason that we have to employ medical interns and ComServes. Also, honorable members will see that from our presentation, we constantly refer to the issue of pressures, particularly in goods and services and compensation of employees, and we move funding in between the different responsibilities, particularly between the non-negotiable items and the negotiable items, just to make sure that throughout the year there is budget to actually pay, particularly for those services of goods that have already been procured. Parallel to that, we are implementing a cost-saving plan in order to actually reduce our expenditure and also reduce our projected over expenditure. And we are prioritizing those areas that are not patient-related or not our core functions, like training, like issues on travel and accommodation and all those areas. And there is a little bit of a shift in terms of our projected expenditure. We have set up particular project teams to actually to focus on different areas of reducing expenditure, including the issue of revenue enhancement. We have actually written to the CEO of RAF because they owe us quite millions of rands, and we've actually written to the CEO actually to clear what they owe us, which we think will contribute to our revenue enhancement strategy. And we're also looking at a number of revenue streams where we can collect revenue in order to improve on our revenue collection, and possibly we might get something in return if we exceed our target. At this stage, I'm going to just ask Mr. Shezi just to take honorable members through our financial status as at half year. Thank you.
Thank you, HOD. Greetings to yourself, Honorable Chairperson, honorable members, MEC, HOD and colleagues. It is a mid-year budget performance report as indicated. So if we go straight to slide number 3, wherein we are reporting that instead of the 50% straight line benchmark, we were sitting at 50.9%, which then translates to that 5.386 billion rand projected pressures as reflected. We are linking this to the amount of accruals and payables that we inherited from the last financial year. And perhaps just as a reminder that amounted to 3.2 billion rands that was actually effected in the month of May 2025 in terms of payment thereof. So compensation of employees indeed is one of the areas where we are struggling as indicated by the HOD, where we are estimating that about 1.380 billion rands sits as projected pressures, mainly because of the partially funded wage agreement and then cost of living adjustment that had to be paid as part of conditions of service. But to then narrow the gap, we are progressively shifting funding between goods and services to this first charge, economic class, like we've done in the current year. We have moved about 1.056 billion rands already. And that movement has actually been supported also by Treasury in writing. As part of also the in-year movements of funds, shifting environments, whilst we were awaiting the adjustment estimates, we were already overheating in the balance of other GNS items, goods and services items outside that fall outside the category of non-negotiables. And so we have had to actually also move a bit of funding from a few of them as indicated, like your medicines, medical supplies, and laboratory services. A portion of funds were actually moved towards the balance of the GNS items as indicated. So that we actually facilitate payments within 30 days. That was while we were still waiting for the adjustment allocation as it were. So the overall pressure now within goods and services is sitting at 4.108 billion rands as at midyear. We're also reporting that households were already overheating at 60.9%, and the major cost driver here is the payment towards medical legal claims, which had already exhausted its allocation of 143 million rand. Because we're sitting at 119% already from this end. Translated into rands and cents, it's about 167 million. Trailing behind within transfers, but to local government in terms of the eThekwini municipal clinics, this was trailing behind at 40.7%, with about 3 months worth of outstanding claims valued at 92.274 million. Underspending was also machinery and equipment at 19.4%, mainly from the health facility revite grant, as would be explained further. But this economic class still projects to overspend by more than 143 million rand. But there is a catch-up plan that has actually been invoked already to mitigate this. Continuing, now detailing the in-year adjustments. So there has been movements from mostly all programs, from goods and services to COE to narrow the gap as indicated in the overview slide. So the subsequent slides from slide 4 actually provides a breakdown of such movements. So there has been that equal movement in terms of COE and goods and services as detailed. The breakdown of affected negotiable items that had to be funded include advertising, forensic investigations, travel and subsistence, telephones, and others that actually are also equally important towards the day-to-day running of our activities as a department. Continuing with the movements, now I'm on slide 5. We are just reporting that the 2024 projected expenditure plus CPI really also adds in terms of the pressures that are affecting our fiscus in the current year. And to address the pressures, as I've indicated, we've had to move also to redirect funding towards the non-negotiable items, or from the non-negotiable items, medicines, medical supplies, and lab services, to partly fund critical items like your external audit costs, your fleet services, your property payments, to avert our services being terminated by the municipalities. So in Program 1, in as much as I will not go through the slides verbatim, there was a movement of 185.228 million rands to actually cover identified items as delineated within that particular program, the administration program. Program 2, logistical services, was reduced by 50.832 million, and the affected programs are actually broken down in terms of the district hospitals being affected by this to the tune of 89.523 million. And then we are detailing the exact items that were actually affected in this regard. District management, also is a sub-program, was affected to the tune of 9.927 million to cover pressure on under-fleet services, whilst the community health clinic sub-program was increased by 13.339 million to also assist with pressures from property payments and fleet services again. Continuing with Program 2, reprioritized was an amount of 4.0808 million within the program to cover pressure under community health centers, specifically property payments and fleet services again. And then so the list goes on within this very district services program. So that breakdown is provided as indicated. Within Program 3, emergency medical services, again, to cover mainly fleet services, goods and services, for both sub-programs in the form of emergency services and planned patient transport, and the actual values are actually provided. Within provincial hospital services, this program was reduced by 192.383 million. Again, affected items within goods and services. In terms of the economic classes, was goods and services to the tune of 163.283 million. But the main sub-programs here affected is the regional hospital sub-program, primarily in terms of those items, medical supplies, consultants, business advisory services, medicines, and so on. And the various sub-programs, including the TB sub-program, with movements of funding as actually detailed to actually provide or alleviate pressure in the negotiable items as detailed. Central hostel services also reduced by 40.994 million. Again, goods and services to COE, but also to cover pressure in the line item that we used to pay for the unitary payment towards the public-private partnership contract we have, because it had also been adversely affected as we prioritized funding for non-negotiables. Within Program 6, Health Sciences and Training, this program was increased by 712,000, which was moved to fund the shortfall under goods and services, fleet services, or under EMS training as a sub-program. And so the affected items are actually detailed in the slide as indicated. Slide number 10, Program 7, Healthcare Support Services, was also decreased by 733,000, which was mostly savings from the balance of the GNS items outside the basket of non-negotiables, mainly under orthotics and prosthetics services, also to alleviate pressures within fleet services and laundry services sub-programs. And then lastly, in terms of program movements in health facilities management, no adjustments were actually effected in this regard. So slide number 12 provides a breakdown of programs leading to the bottom line pressure of 5,386 billion as indicated. So the greatest contributing programs in this regard is the clinical programs, programs 2, 4, and 5, with district health services leading in terms of the pressures. Slide 13 provides a pie diagram reflecting the same information. Now going into the budget performance per program, in slide 14, program 1 was significantly overspending at 96.9% due to the nature of the fact that we pay our laboratory services centrally and then generalize those expenses to relevant clinical programs in subsequent accounting periods. Otherwise, compensation of employees was at 52.2%, obviously above the mark, leading to that shortfall of 40.6 million rands. Reasons are as highlighted in the overview slide. Goods and services pressures within program 1 are at an estimated 157.952 million. And the affected items includes legal services, property payments, communication, audit costs as listed, And again, the impact of the 2024-25 accruals did have an impact in terms of this particular program. Digital services in program 2 was at just under the market, 48.9%, due to the outstanding NHLS journals from program 1 as indicated. However, compensation of employees also show a bit of pressure as it was sitting at 50.8%. The funding shortfall here is estimated at just above 876 million. Goods and services contributes the greatest in terms of pressure at 1.463 billion rands. And the reasons are really as indicated in the overview slide. And then slide number 16 provides a budget performance, but for breakdown at sub-program level for digital services, and that breakdown is provided in the table. Emergency medical services, program 3 was at 47.6%, but still projects to overspend by more than 60 million rands. Again, compensation of employees and goods and services are a culprit. And we're also providing a breakdown per sub-program in terms of emergency services and planned patient transport, in terms of how much they are contributing to this picture. Provincial Hospital Services, Program 4 on slide 18, shows the pressure estimated at 1.674 billion, and it was sitting at 51.9% of the main appropriation. Again, compensation of employees, shortfall more than 319 million, and goods and services shortfall is at 1.167 billion. The reasons are exactly alike in terms of other clinical programs. And the values in terms of contributing items are actually detailed in slide 18. And likewise, in slide 19, there is a breakdown of the sub-programs and their performance at Midyear, leading to that total bottom line of 1.673 billion worth of pressure. Central Hospital Services in slide 20 was right on the market 50%, but still projects a shortfall of more than 962 million. Again, compensation of employees and goods and services being the culprits in terms of where pressures emanate from, and the sub-program picture is detailed in the table provided with regard to Central Hospital Services and Provincial Tertiary Hospital Services, contributing to that bottom line picture. Health Sciences and Training in Program 6, with pressures estimated at just above 51 million rands. Again, root causes are goods and services and COE. Again, with the impact of reallocating funding from non-negotiable items to other programs, also impacting this particular program. Pressure, GNS is estimated at 12.656 million. And the slow spending on the households is mainly attributable to the bursary program, since there was no intake of the Cuban students, Cuban training students in the year. And the breakdown per sub-program is also provided for health sciences and training, and that listing is provided in the table as it were. Continuing to slide 22, healthcare support services, which was grossly over spending at 119.6%, and projects to overspend at year end by 32.226 million. COE is a culprit again, with pressure shortfall estimated at more than 8 million rands, and goods and services pressures also amounting to more than 23.185 million. Breakdown of sub-programs also provided, as can be seen on the table below. And then lastly, in terms of Program 8, which was at 36.2%, way below the mark, as indicated in the overview slide, but still projects that minor 11.616 million. This speaks to some of the projects that had to be reclassified under maintenance, resulting from the Auditor General report in terms of matters of emphasis that were identified under material non-compliance that had to actually be rectified. But due to other programs that had actually stalled, as the narrative is provided in the relevant slide. The detail in terms of the economic classification is provided in the table in slide number 25. And in the extreme right column, where pressures are actually captured, it's clear that the greatest contributor is the COE at 1.379 billion and goods and services at 4.1 billion. Just talking to the most material contributors in terms of the bottom line picture. And the details in terms of breakdown is actually included in the program analysis slides that have just been concluded. Moving to our earmarked funding, conditional grants, slide 27 provides a table with all of them. Just to, well, bottom line, they were sitting at 41.97%, which is below the mark in terms of the straight line benchmark of 50%. So just highlighting those that are below that particular mark is district programs grant, which is 42.71%, and the HFRG as indicated at 26.96%, followed by the NTSG, the National Tertiary Services grant at 45.25%. So the narrative is provided from slide 28. And the district health programs grant, which is trailing behind as indicated, and this is linked to the backlog of the ARV medicine expenditure payment that had not been processed as at the reporting time, and the NHLS monitoring test journals and the 2 months worth of outstanding eThekwini municipal claims that were that are trailing behind as indicated in the overview slide. And staff are actually in the process were in the process of being recruited towards the medical male circumcision and the ART programs, which will actually prop up spending in year towards a balanced outcome, which is projected. The HFRG, the one that is grossly underspending due to some of the vacant posts that had not been actually filled as at the reporting period, and the recruitment process was actually underway to actually assist in this regard. And then, but mostly impacting this particular grant performance was a majority of health technology services projects, which are still awaiting delivery in terms of the requisite medical equipment, and expenditure is expected to pick up in the remaining quarters of the financial year. The human resource and training grant was above the mark at 52.87%. This is as a result of the appointment of the new interns and usually would get regulated in year in terms of whether it's a mid-year or the January intake that is actually at play. Following slide number 29, the National Health Insurance Grant on the market 50.78%. So the HP contracting program had delays still in terms of the recruitment processes, and the contracted medical officers, which actually funded from this particular grant, was a root cause in this regard. And then the NTSG at 45.25%, below the guideline, mainly because of the outstanding NHLS payments that still had not been made at mid-year. And then lastly, the EPWP integrated grant for provinces above the market 55.27%, and as usual, the overspend is actually absorbed by the equitable share funding because obviously we can't overspend on earmarked funding. In terms of revenue performance, the budget is more than 281 million, and the collections are actually detailed in terms of what we had collected up to end of August, the 124.238 million, and for the collection for September, it's sitting at more than 22.417 million, leading to that total at mid-year collection in terms of that 146.655 million. So we are, in terms of the average collection, we are just slightly under the target because we are supposed to be collecting 23.431 million. Relative to the collection month of September. Otherwise, the current average collection in terms of the projected year-end collections, we are above that. So we are actually well set to actually exceed our annual target. So the outstanding collections from the RAF and other statutory bodies will actually help us to even perform better than the projected over collection as it were. I think that's the end of our presentation, Honorable Chairperson and members. Thank you.
Thank you so much. Acting CFO, where? Okay, yes. No, thank you so much. I'm sure there's no additions, Shoti. We can take members. Okay, thank you so much. Honorable Naye. So we've got Honorable Naye, we've got Honorable Seme, Honorable Kanye, and Honorable Dex. Honorable Naye? Or not yet, Honorable Pasiera also.
Thank you so much, Chairperson, and good day to the Honorable MEC and HOD and your department. It's very concerning when you look at the overspending that's projected, over 5 billion rand at year end, and the fact that you've had violence within the department and it's still not putting you in a better position. I want to just touch on a progress update on the ongoing development of a savings plan. I know you touched on it, on areas that you anticipate savings. But I just want to check, do you not have it in a document, a concrete saving plan, a way forward of how you're going to turn things around, other than getting an injection of budget into the department? And also the plan of the rationalization of services. Are there any programs that you could possibly cut within the department in order to turn things around? Because from what we're looking at, even the additional cash injection is not adequate to turn things around within the department. So I just want to see whether you have a plan or, you have some thought in the pipeline with regards to cutting somewhere. Because when you bring it down to the most basic, or you approach it in the most basic way, it's obvious that there needs to be some cuts somewhere. Thanks, Jay.
Thank you so much, Honorable Chair. Greetings to the department and the MEC, and thank you so much for the presentation. Honorable Chair, my questions are I have quite a few questions. To the department and the MEC, on Program 4, it shows that medicine and medical supplies are running at 59.28% of a budget, yet still projecting 490.7 million shortfall, with 270 million rands that's being 2024 and 2025 accruals. Now, can the department tell us how many hospitals we province have already ran out of immunity and been forced to turn patients away because of these accruals and budget cuts. Second one is on Program 5. It has 412.3 million under budgeting of the triple P payment alone, plus a further 388.7 million cut in negotiable items. This is a tertiary platform for the entire province. So can the department explain how it intends to avoid a complete collapse of this service at academic hospitals with the triple P payment is legally non-negotiable and already underfunded by 400 million halfway through the year? On Program 7, Honorable Chair, is already at 119.6% of its halfway budget, and it is projected to overspend by 32.2 million rands. This program includes, Honorable Chair, medication courier services, the pharmaceutical depots. Now, Honorable Chair, my question is, given the medicine are already under severe pressures, Program 2 now Program 4 and 5, how does the department justify allowing medicine delivery program itself to overspend while frontline facilities cannot get stock? And my last one will be, multiple programs blame negotiable items being cut to fund non-negotiable items and current warm bodies. Now, Honorable Chair, can the department table the exact document that lists which budget lines are classified as negotiable and which ones are non-negotiable, and confirm whether medicine, lab services, and municipal services for hospitals were ever classified as negotiable items that can be raided? Thank you so much, Chair.
Thank you, Chair. Morning to everyone. I'll have two questions. First one will be, according to AG reports, health management facilities of Program 8 is at 36.2% spending, yet is still projecting an 11.616 million overspending because projects were reclassified under maintenance. Then my question to the MEC and the team, does this mean the department was previously misclassifying maintenance as capital projects to circumvent Treasury rules? Will the accounting officer be taking any disciplinary steps against the officials responsible? And the last question will be, the presentation repeatedly cites 2024-2025 accruals as major driver of current year treasures. Visible figures already exceed 1.1 billion across programs. Can the MEC explain why 2024 financial statements apparently understated accruals to this extent? Whether National Treasury was informed and whether the Auditor General has been requested to perform a special investigation into the accuracy of last year's accrual note. Thank you.
Honorable Dex.
Thank you, Honorable Chairperson, and good morning to the Honorable MEC, and good morning to the HOD and your team, and thank you very much for the presentation. I hear you say acting CFO, Honorable Chair. I hear you said there's the acting CFO here. Is it acting CFO?
Yes, MEC, Honorable MEC.
It's not. Oh, there it is. No, I think, Chair, it's an oversight because when we started, we didn't present any apologies. Our CFO is on sick leave, so there is acting based on that. Thanks.
Okay. No, thank you very much, Honorable MEC. Yeah, Honorable Chairperson, through you to the MEC and the HOD and the team, I just want to find out on that program 1 on the administration. I see that you have spent already 96.9% of the half-year budget. So effectively, that's about like 6 months allocation. And this year, the reason why that has occurred is because of the 661.774 million central payment for laboratorial services carried over and unprocessed journals. Now, why? I just want to find out from the MEC, why was these massive carryover commitments from the previous financial year not disclosed at the time of the 25-26 adjusted appropriations? And who actually authorized this year? Who authorized the central payment instead of allocating funds to the correct program? I just want to understand how that happened. If the MEC can perhaps just inform us on what actually transpired there. Then the second question, which I think is my last question, was I think Honorable Sema already asked the question that I wanted to ask. The last question that I want to ask is regarding the shortfalls. If you add it up it's in excess of the 5.5 billion at the halfway mark. District health is sitting at 2.3 billion. Provincial hospitals at 1.6 billion. Central hospitals at 962 million plus others. Now, this is going to put great pressure on the department. I just want to find out from the MEC, does she have any plans for emergency funding here? I don't know. I was going to put the department in serious problems. Is there any plan for emergency funding? National, I heard that money, as the honorable member the back said, Naya said that 200 million, that is not even enough, cannot even cover it. Is National Treasury not going to? Is there no way National Treasury can come on board and assist with funding for the department? And then lastly, the goods and services in program 2. There's a shortfall of 1.4 billion, of which 477 million is for medicines and 235 million is for laboratory services again. Now, these are frontline services. Now, we know what happened the last time with the issue of medicines, in the hospitals. Now we're going to have again another shortfall, and come by next year, early next year, later this year, early next year, will it not affect the dispensing of medications to patients? That's my only 3 questions. Thank you very much. I hope it was clear.
Okay. Thank you so much. Yes, MEC.
No, thank you very much, Chair, and thank you to the members for the questions. I will just respond to a few, and then HOD and the team will respond to the rest. But I wanted to start, Chair, with Honorable Naya's questions on savings plan. Chair, we have a savings plan, and I believe we submitted it early in the year. But this plan, Chair, is also not a new one, because we realized last year that our challenges were becoming bigger and bigger than we expected, and we started implementing it back then. So we will submit the plan, Chair, if members want us to do so. But it goes without saying that when you start having challenges like this, you then have to prioritize your core. And the core is ensuring that the clinical care at a facility level is actually being conducted. That then says, without any doubt, some programs are affected. There are programs that we had to stop. there are programs that we had to reduce the implementation of, so that we are able to get funding in one area or the other. The challenge, though, Chair, with reducing programs that are community driven in particular, is that then that affects our primary health care, because our community outreach programs are a pillar of our primary health care. And once you affect primary health care, then the value chain goes up. Then it means people get sick more, and you have more people coming to facilities when actually you could have dealt with them earlier on. So it becomes a rolling program when you try to close one tap and the other side is opening up. But with that said, we do have a savings plan, and as part of our savings plan last year, we decided to stop. Last year we did not buy any vehicles at all, except for ambulances. And I think this financial year we did the same thing as well. We stopped buying vehicles. But remember, when you don't buy vehicles, then it means you have outreach teams that are not going to be able to go out to communities, because when you don't replenish your fleet, then it means you don't have enough people that will go out to communities. But we had to decide what we had to choose a better David, and we had to choose what is it that we are going to forego while we proceed with the other work. So I'm just explaining that, but putting into perspective that there is a savings plan. What I'm giving you now are just examples of the things that are in the savings plans that we've had to actually stop or not consider. We've had to consider, Chair, something that says, should we stop some 24-hour clinics? Because if you stop the 24-hour service, it means then you reduce the number of staff that's in a particular clinic, and therefore you are able to move staff around and move staff or excess staff from that clinic to a different clinic, and therefore you don't have to employ more. We have had to consider that. But if you close down a 24-hour clinic where it has been set up, you are then compromising the clinical element that the communities are supposed to be getting, benefiting from. So we are looking at different things, and there's quite a number of other things that we've got on the savings plan. Chair, with your permission, can I request Honorable Seme to just indicate to us, I heard she was talking about the running out of medication, Chair. I would like if she could just repeat that and maybe just indicate which slide she's referring to so that I can respond. Can I ask that, Chair? All right.
Of course, other questions are still going to be dealt with here.
Honourable Chair, thank you so much. Honourable MEC, on Programme 4, my question was, it shows that medicine and medical supplies are running at 59.28% of a budget, yet still...
Which slide is that, Honourable Sir?
On Programme 4.
Yes.
What slide?
What slide?
Yeah. Give me the presentation. It's just like the question I have to read.
One eight.
I'll show you now. Four.
Okay. All right, I found it, Chair.
Okay.
Okay. No, I found it. 18, eh?
Yeah.
Yeah, okay. No, thank you very much, Chair. Maybe let me just explain what that means, Chair. That 59.28 is a shortfall of the budget, not shortfall of the medication. So what it means is that when you budget, we had requested, I'll make an example, we had requested 100,000 rands to buy medication, but we have been allocated 59,000 rands. Therefore, what that means is that as the savings plan, we then need to go and look into the whole budget and see what is it that we are not going to do so that we make sure that medicine is available. So medicine is available. It's the monies that are not enough that are there. So we must take from other line items for us to be able to buy this medication. I don't know if I've explained that properly, Chair. Then the next question, MEC, not MEC, Honorable Sebe was asking about non-negotiables, Chair. So the non-negotiables, Honorable Sebe, you can look there on slide 5. Such as medicine is non-negotiable. It has never been a negotiable. Medical supplies are non-negotiable. Security services, non-negotiable. Patient nutrition, that means the food that the patients eat daily, are non-negotiable. Laboratory services, non-negotiable. And infection control related items are non-negotiable. So all of these are non-negotiable. It means we can go without anything else, but there is no way we can go without what has been mentioned here on non-negotiables, Chair. I think I just wanted to explain that. And then the last one is the matter Honorable Tex was talking about, on whether there is a plan to engage National Treasury. Honorable Tex, we have been having various discussions between ourselves, the Premier, Honorable MEC for Finance, and the National Minister. But it is true, the next point of call is actually going to the Minister of Finance to actually put our case on the table. And before I give to the department chair, I also just want to indicate to members that, and just remind the members that the reason we are in this problem is as a result of the cutting of the budget cuts over the past years, emanating from 2019. So it's not because we have gone out and spent on monies that we didn't have, but it's purely because the allocation that we have been given over the years has been cut, despite the fact that there had been commitments that were made. I'll give you an example. You employ a nurse or a doctor today because you are very much aware that you have 500,000 in your budget. But once in the next financial year, that 500,000 is reduced to 350, you can't then fire the doctor or the nurse that you have employed in the previous year just because your budget has been cut. So that has been primarily our challenge, Chair, when it comes to our finances, the budgetary constraints and the cuts. However, we really are trying to make sure that we live within our means. And Honorable Tex, we are really trying to engage the National Treasury as well in this regard. Thank you very much, Chair. Can I hand over to the department? HOD.
Thank you very much, MEC, Honorable Chair and Honorable Members. Maybe just to add on the issue of the cost-saving plan and also what we are doing as a department. In slide 4, we are actually explaining that we did an extensive review of our spending trends and the impact of budget cuts. And in that review, we decided to prioritize compensation of employees as well as non-negotiables, the list of items that MEC has mentioned. There are 14 items within the budget listing of the department that, according to regulations, we must actually protect at all times. When we did that, we actually, particularly under goods and services, we developed a cost-saving plan that was costed at a little bit more than 1 billion, which we submitted to Treasury. And we are implementing that cost-saving plan, and it looks, as I had indicated earlier on, at non-core items or non-negotiable items. However, the tricky part is, whilst we have that a cost-saving plan estimated at 1 billion, when we realize those savings, they go towards a compensation of employees. Because as much as we prioritize compensation of employees and tried our best to fully fund compensation of employees so that we do not have problems of staff that are not paid, we could not fund the pay progression as well as the cost of living adjustment, totaled at 7% of the total budget. So as much as we funded the COE, there was that outstanding about 2 billion worth of a budget that we could not fund because of the shortfall and the accruals that we have. And also, whilst we actually said we will protect the non-negotiables, as the year progresses, we found that we are projecting over expenditure and cash flow programs in the negotiables now. And then we had to reprioritize budget from the non-negotiables to the negotiables. So it's a continuous balancing act. Hence, our recovery plan is not a plan where we are going to realize complete financial recovery over 6 months or over a 1 year period. It's a plan that looks at almost the 80 to 90% recovery by the 3rd year from now. So, because from time to time, it can only be a complete recovery in a short period of time if we get additional injection of funding, which is also estimated at around 6 to 7 billion. So continuously and all the time, we move funding from the different score items in order to ensure that we do not run out of cash and that our service providers are paid. And that is how I think Honorable asked, how do we aim to prevent a complete collapse of the services? That is the way that we are working, that we are moving budgets from areas of pressure and to of underspending to areas of pressure. In terms of also our savings plan, we have also even frozen quite a high number of posts, more than 3,000 posts that we have frozen so that we do not fill these posts. And we are grateful for the adjusted allocation that we have received that is going to assist us in order to recruit critical staff that we do not have at the moment and where we have high vacancy rates. The issue of journaling in terms of NHLS payments as well as municipality payments, I will leave to Mr. Shezi to respond. Thanks.
Excuse me. Thank you, HOD. Maybe perhaps just to also provide additional information on some of the questions raised, starting with the observation in terms of Program 5, wherein there's a concern that it does project to overspend, and it's mainly because of the PPP payments that we actually have to make. Versus whether or not, why are these not perhaps made to be part of non-negotiable items? Just a reminder that this is a national, it's a sector concept. Non-negotiable items are actually decided at sector level, in as much as we also provincially are at liberty to prioritize some of the balance of goods and services items. But the reason why, now coming back to the concern or the observation made, the reason why the service fee or the unitary payment towards the PPP contract for the service provider is one of them items that were actually shortchanged. It's mainly because, number one, it doesn't befit or it doesn't fall within the category of non-negotiable items. And the plan was provide funding up to the adjustment estimates, because we knew that as part of the 20.7 billion that we're expecting as a sector over the 25-26 MTF period, we knew that a portion of that was going to come our way, such that we then further reprioritize a portion of it towards the some of these items to take us towards financial year end. But again, a reminder that the accruals and payables that couldn't be recognized in the last financial year remain not cash backed, so they are not funded. So what they actually do is they eat on the very allocation of the subsequent financial year. Obviously, the HOD has explained that to then minimize the impact thereof over the next few financial years, we have then developed this financial recovery plan. It doesn't only look at expenditure reduction, but it also looks at revenue enhancements, because the more we collect, the greater the chance of us retaining a portion of that over collection towards investment in additional revenue generating activities within the department. So it is available, it's in writing, it's detailed, it's quantified, and it's a multi-financial year recovery plan. Obviously, one of the underlying assumptions as we develop that plan is that the department is going to be shielded from further budget cuts, because it compounds our problems if we are planning on a shifting baseline. So I thought perhaps one will bring those matters up just at principle level. The observation in Program 8, the fact that it's underspending but still projects to overspend. The bulk of funding within Program 8 is earmarked in nature. It's through the Health Facility Revite Grant, and that funding cannot be used for any other purpose except that which is detailed in the grant framework. So the projections in terms of the business plan that supports the grant are actually included as part of those projections, and which is why I emphasized the grant, the catch-up plan that we already have invoked to ensure that that funding is indeed spent in accordance with the requisite framework. Now, perhaps my last comment is that the one on the fact that Program 1 is grossly projecting to overspend because of NHLS, and why that is actually the case. So the department is decentralized in terms of its management, managerial arrangements. Lab services are provided at facility level. We have 69 hospitals, we have 22 CHCs and more than 600 primary health clinics. So lab services are provided at that decentralized service platform, in as much as those responsibilities do get their detailed invoices, but payment is actually done centrally. So part of the payment process is such that the invoices are verified by the various responsibility managers supported by clinical medical managers, such that it then allows for that payment process to be then done, supported by such confirmations in terms of correctness thereof centrally. And then after payment centrally, the expenditure now gets to be channeled back to source in terms of where it was actually incurred. So that's just an ongoing in-year processes. It will happen this month for journals to be actually done in the subsequent accounting period. So it's just the nature in terms of how it's actually applied. Perhaps my last one in terms of the observation in Program 2, Goods and Services, in terms of the huge projected pressure there. So Program 2 actually houses the majority of our hospitals, CHCs and clinics, because that's district health services. And as such, it is then the greatest in terms of contribution, whether you're talking compensation of employees, because it is also staff heavy, because that's where the bulk of our nurses, doctors, and other staff members are actually placed. Likewise, in support of the services that are rendered at that level, the bulk of the money for goods and services, likewise, the pressure will actually come from that end. Thought perhaps I add those few comments through you, Honorable Chairperson. Thank you.
Honorable Nai.
Thank you so much for those responses, and thank you, Chair. Just a few comments. I do hear that you do have a savings plan and a turnaround strategy or recovery plan in place. Now, it's actually quite stressful even listening to the presentation, and I can feel the dilemma that you are in when you're discussing how you're going to be cutting and where you can cut and where you can't and so on. It's quite stressful. People say that, you know, you find yourself between a rock and a hard place, and it seems like you are between a rock and a rock. So I just want to find out, with regards to your recovery plan, your turnaround strategy, have you as a department put that together, or have you employed the services of an independent consultant? Because sometimes it's difficult when you're in something and you know, you're emotional about which programs you can cut and where you can. And it requires an outside eye, or an outside view rather, to look at the department and see what can be done to save the department. Because essentially what you're doing now, by reprioritization within the department, it's simply delaying the downfall or the collapse of the department. And especially because you're taking, you know, funds, budget from other departments as well. Like I know Kotane has given you some budget as well. So we want to ensure that there is a sustainable plan in place that will really bring turnaround to the Department of Health. So perhaps answer that, whether there's been a neutral input in terms of your recovery plan, your turnaround strategy, and also, you know, how often you are updating this and whether that can be submitted to the portfolio committee when you are submitting it to the Department of Treasury. Yeah, I think that is it. But we really do feel the pressure that you are under, and I think this requires a really big move to stabilize the department and rescue this department. Thanks, Chair.
Oh, yes, Honourable.
My apologies, Chair. In terms of savings, I just want to find out whether you dealt with any ghost employees that would have given you a savings in the department. Thanks.
Honourable CQ.
Thank you, Honourable Chair. Greetings to Honourable MEC, HOD, and your entourage. You know, when you talk about, I did say in the previous meeting, this department is very critical in the province of KwaZulu-Natal, because if this department does not get the required budget, the whole department and the people of KwaZulu-Natal are being affected. It's like water, it's life. This department is life. I always say that when we discuss the Department of Health. But the way things are happening, you can see that we appreciate that there is an extra funding that has been given to the department, as the MEC has alluded or presented before us. But the problem is on the COE, unfunded or underfunded, even after reprioritization. Because these cuts that has affected a department for more than 2 years, 3 years, you know, just cutting. I think the MEC has indicated that the challenge that they are having, if they have employed people today and tomorrow there is a cut, it becomes very difficult what to do, because you can't fire that person because now there is a cut. I am not sure, because on the presentation that we had with the Treasury, they indicated that the problem also is around the goods and services, because also the money that has been moved to try and fund the compensation of employee, which is really a problem. I am not sure because there is a presentation that indicated that these three departments, maybe a Department of Health, Treasury, and National Treasury, when they are discussing this thing, to try, because the money that has been given, I don't think it's making any difference to the challenges that this department is facing. And they will keep on coming to us, questioning them, and not changing anything. Because the critical budget for this department, we talk about non-negotiables. If there is no medication in the hospital, we come back and throw stones at the MEC. Where must she get money? I'm really not sure of the National Treasury. I know I heard that the MEC said that the Department of Health nationally also tried to intervene and so on. But I think maybe if we can discuss the injection of the budget to this department. Otherwise, colleagues, it's very unfair for this department to always come to us and hear the stress and the pressures that they are having as a department. We are the lawmakers. We are the one also that passed the budget here in this legislature. But even if we try to increase a little bit, I don't think it's really making a dent to these challenges of this department. You know about the cuts. You know about the COVID-19 employees that were also employed without being, budgeted for because they were there were strikes and so on. But Chair, I don't know what can we do, or because we have raised also with Treasury to say that can they assist the Department of Health and Department of Education, because these two departments really, if they are not well budgeted for, I think the whole province is going to collapse. But what I want to check on the department now, because this one is just a comment and a stress. I feel like not asking questions because I know what are the problems, and I can't assist on those problems. Chair, now is a question to the department. There has been an ongoing a cost that has been incurred around the interest that is being charged, but it's channeled to like it's for municipal and telecom, but it's incurred continuously. What one want to establish is...
Yeah, I just want us to be mindful of time.
Okay.
That we now have literally 2 minutes. So if you ask, please finish your question, Honorable CQ, so that we can give them some space to answer. My apologies for that, my leader.
Okay. No, I want to check the interest that is ongoing incurred by the department on the charges for a municipal domestic account as well as telecom. Does this interest also part of the accruals that has been reported by the department that is taking place? Thanks, Chair.
I'm very limited, honorable members. Honorable Nai, I've got literally 1 minute now.
Thank you, Chair. Thank you for indulging me. Just a very important question before the department responds. We know that there was a moratorium on employment of doctors, and then we heard that the minister was providing some budget for doctors to be employed. Just give us clarity of whether there's going to be employment of doctors in the province with regards to that additional budget, or whether that has ceased as well. Thank you so much, Chair.
Okay, thank you so much, Honorable MEC or the team.
Thank you, Chair. The first one, Chair, is questioned by Honorable Naya on the savings plan. Did we draft it ourselves, or the department, or did we get a consultant? We drafted it and implemented it ourselves, Chair, because again, we couldn't afford to get consultants. However, after we had put it together, we then had a session with Treasury and we went through it so that they also were able to have an input on it, and they did. And some areas that we maybe were blind spots for us, the Treasury brought them in, and eventually what we are implementing now is something that has been dealt with by both sides. The issue of moratorium on doctors, we've never had a moratorium in the province, Chair, of employment of doctors. We just didn't have money to employ them. So there's a difference. We just did not have money to employ them. So with those challenges, we then went to the provincial executive, and there were funds that were, well, we had our own funds, and out of our own funds, we were only able to employ 20 doctors. And out of the engagement with the provincial executive, we agreed on an employment of 100 more doctors, and that's what we have started employing. In fact, interviews are continuing as we speak. The first 20 has been appointed. The second 100 is now proceeding with the interviews. With the 1.4 billion that comes from national, yes, we will also add some more doctors, but we are working on how do we share the monies that we've been given within the health workers, because it's not just the doctors that we need. We need doctors, we need nurses, we need allied services. So we are trying to spread the amount. But yes, there will be more doctors that we will advertise for as well. Thanks, Chair. HOD.
Thank you very much, MEC, Honorable Chair, and honorable members. I will just also add that actually some of our managers are part of the work streams that are coordinated by Treasury in terms of implementing the cost recovery plan. So there is support from Treasury. There is also support from the cluster audit committees that actually interrogate our progress and how we are implementing the financial recovery plans. So that is the kind of external support that we are getting, as MEC has indicated. I will also speak to the issue of interest incurred by the department on municipal payments. We have put in a system that interest we incur mainly from municipal payments, because municipalities start charging us interest at 15 days instead of 30 days. We tried negotiating that they actually extended to 30 days, but they did not agree. What we have done then is to issue out a circular advising facility management on the processes and the timelines that need to be followed in terms of processing a municipal invoice. For instance, the circular says as soon as the invoice is received within a period of 2 days, that invoice must be captured on the system. And within 5 days, that invoice must have been authorized and ready for payment. In addition to that, we have advised the facility systems managers to actually do their own meter readings so that they can, as quickly as possible, submit their meter readings to municipality. The invoices are received and they are processed in the shortest time possible. I think, and then in terms of the ghost employees, we have done a recent assessment or investigation into whether we do have ghost employees in the department. We have a report of all the facilities that have done, and we did have found a few staff members that could not be accounted for during the audit, and we then have busy undertaking investigations through our departmental investigation services. But one must say that most of those are around the community healthcare workers who do not report to a facility on a day-to-day basis. We are conducting investigations to actually conclude whether they are ghost employees or it is because they are not reporting on duty as they are supposed to. We do have a report, a comprehensive report on that exercise. Thanks, Chair.
Thank you so much. We really apologize because we are pressed for time. I'm sure members still wanted to do the interaction, but I think with the responses that we've received, I think we're quite comfortable. Thank you so much. Honorable MEC, can I give you your closing remarks?
Thank you very much, Chair. I appreciate the support that we are getting from the Finance Portfolio Committee, and I do want to make a commitment, Chair, that we are doing our best and will continue to do so to manage our finances in the best way possible. On a lighter note, Chair, I think kuyasiza ukungena ekugcineni kwama-sessions ama-honorable members asekhathele ukulwa, so the next time ngizocela ukungena ekugcineni. Ngiyabonga.
Honorable members, we will call it, we'll just hold it here with the Department of Education, and then in the next 2 minutes, we'll have then the Moses Kotane. Thank you so much. The meeting is closed. Honourable members, I think we can then just start because Moses Kotane is here already. So you are most welcome. Honourable members, we are reconvening. We have received a written apology from the Honourable MEC. So a men's team, Honourable CQ, a men's team is here. Yeah. Yeah. Okay. Yes, we also have an apology of the CEO. Yeah, we received the written apology from the CEO. CEO is Dr. Ellison. Ellenson. Is a female. Yeah, is a female. At least, yeah, no. So you'll guide us. Please do introduce yourself and then take us through your presentation.
Greetings, Honorable Chairperson and Honorable members present. My name is Cosmas Samadziripi. I am coming from the Department of Economic Development, Tourism and Environmental Affairs. I am the shareholder representative of the department to the MKRI board. Thank you very much. Our CFO was also going to join virtually. He's off sick, but I'm not sure if the meeting allows that. But yeah, he was going to join virtually. Thank you very much.
Thank you. Greetings to the Honourable Chair and to the Honourable members. My name is Dion Govender, and I'm the CFO at Moses Kotane Research Institute. And like was said, I bring apologies from our CEO, who is currently in Spain, receiving an award for some work that MKRI has done on research with regards to cultural heritage and investment tourism. Chair, I'll have the pleasure of taking us through the midterm review. The first few slides, Chair, may I proceed and just go through the presentation? Right, the first few slides are just with regards to who we are as an entity. So I'd like to skip to slide number 5, please, which will take us into the crux of our meeting and the budget that we're looking at. Our revised expenditure estimates over the MTF. Our main budget for the current year is 113.8 million. It's made up of direct funds of 70.9 million from our shareholder Etia, 38 million from our Masita project that we're busy with, and 4.8 million for our sundry income. Yes, so that's just the budget over the MTF. If we go to slide number 6, it's just a breakdown as per economic classification. I would just like to highlight compensation for employees as 41 million, and that equates to 60% of our voted funds go towards compensation of employees, and the balance of the goes to the program and operational expenses of the entity. As a skills-based entity, our compensation for employees is much higher than other entities because we deal primarily with research, and therefore our skills base is very important. Hence our high cost in terms of the percentage breakdown. Slide number 6 speaks to our revenue collection. We currently receive 74.8% of our budget. We receive the balance of 29 million from voted funds in the next 2 quarters. In the current financial year, our Masita project has brought in 38 million, which we have currently disbursed. So hence our revenue collection appears to be much higher than 50%, but that's because we've received 38 million in terms of the budget for the Masita project. Chair, the next slide I'd like to spend a bit more time, which is our expenditure slide. which speaks to the expenditure of the entity. Our adjusted budget is 113.8. At year end, we had incurred a total of 73.6 million. Corporate services had spent 58.6% of their budget. Research is 32.6% and development is 77.9%, with a total spend of 64.7% currently. Excluding the Masita project, the entity is at 48% of voted funds. With that, we anticipate that we will complete the year within the budget and with minimal rollovers. Slide 8 shares just a graphical representation of our budget over the MTEF period. Slide number 10 relates to our Masita projects, which is additional funding that we received through Masita for skills development. I just want to highlight the progress of the project. So the budget for the project is 202 million. We've actually received 111 million thus far. So we left with a balance of 90 million that needs to be dispersed to the entity. 68% of that completed is a skills training. So the skills training, we've trained 3,550 learners across the province, and the training has been completed, but Masita is busy with the verification of the information. So as it stands, we've only received 68% of the funds there. Student debt clearance, the budget for that was 75 million across the universities in KZN, which is the MUT, DUT, UniZulu, and UKZN. Of that, we've received 22 million that was put towards the historical debt clearance of the students. We have completed 29%. We've got an outstanding balance of 53 million that Masita is busy with at the moment. They're busy verifying the information that's submitted by the universities before they pay out the balance of the funds. The third category in the Masita projects was the setup of the robotics and the AI center, or the AI lab at MUT. That has been set up and has been completed and is fully operational at the moment. So in total, with regards to the Masita project, we are 55% complete with that. And it's just the administration that needs to be completed on Masita's side before we receive the funds to disperse. The slide number 12, or slide number 11, sorry, is the capital infrastructure expenditure. Currently, we do not have any major capital or infrastructure expenditure plan for the current year or for the outer MTF years. Chair, in conclusion, the entity is, we believe, underfunded, and we stretch every rand as far as possible. We currently have 17 operational digital centers across the province, and the entity has absorbed the operational costs of the centers into our current budgets. The costs are manageable when we have a few digital centers, but as we expanded and the success of the digital centers meant that it's put a bit of pressure on the entity in terms of operational costs. So currently, the digital centers cost anything between 5 to 6 million in terms of the operational costs per year, which is being funded from our current existing budget. Honorable Chair, I will end there. We've included some slides, pictures in the presentation of our digital centers that have been currently set up. So the members can go to that at their leisure, Chair. Thank you, Chair. I'll hand over to you.
Thank you so much, CFO. Honorable members, a very brief presentation. Hopefully you might be in the position to make comment. Honorable Dex.
Yeah, Honorable Chair, I just want to find out why Honorable de Klerk did not ask any questions when Helt was here. I was quite shocked. There was no questions coming from Honorable de Klerk. Thank you, Chair.
Honorable Nae, Honorable de Klerk must be given a space and time to defend his person.
Sometimes, Chair, I cannot ask too much because I will be pointed out as somebody that's too aggressive and is unfair. So I left it to the clever people to do that, and the ones with enough guts to say what is needed to say. That is it. But on this, Kotane, may I ask my questions?
Yes, please.
Thank you. Just according to Treasury, it appears that if the entity may have over budgeted for revenue to be earned on cash on its accounts, considering that only 22.7% was collected by Midyear. This needs to be reviewed by the entity, and as it will also impact on the expenditure budget. So that's the first issue. The second issue is that Treasury is concerned about program number 1, that's corporate services, and program 3, development services, are experiencing spending pressure, and the entity needs to carefully monitor spending over the remainder of the year. If required, it may need to curb some activities to remain within budget. If you can just confirm that is exactly what you are doing. And why haven't you informed Provincial Treasury of your proposed virements to be undertaken? And when will you do that? Thank you, Chair.
Thank you, Honourable Nai.
Thank you so much, Chairperson. Just some comments with regards to the assets that were transferred to MKRI in line with the Provincial Executive Council resolution. If you could just give us some details surrounding this and what your plan is to deal with these assets, because you have not been able to use them. And then also, we see that the entity is not in a financial position to be able to fill all your critical posts on a permanent basis. And so you've opted to fill 4 permanent posts on a contractual basis. Now, this could potentially be a breach of the Labour Relations Act, we're told. And this situation is not sustainable. So perhaps give us what your plan is in this regard, especially if there is no additional budget allocated to you. And also, on the background of that question, I'd also like to know, how do you gauge, it would be nice if the MEC of ETIA was here. I'd like to gauge how do we gauge the return on investment in your institute? The research that you conduct, how is it being used by ETIA and perhaps other departments as well? Just trying to gauge how effective your institute is. Thank you so much, Chair.
Thank you so much. Let me apologize to Honorable Pasiela. I forgot her because of time in the last. My apologies, my sincere apologies. Yes, CFO.
Thank you, Chair. Thank you, honourable members, for those questions. If I could start with maybe the on the income side, that we've over budgeted for income. In the current period, we've invoiced 450,000 in Q3, which is additional revenue that we've generated outside of our grant funding. We've also been able to secure a tenant for our Westfield offices that we've now leased out, which gives us additional funding. So in our discussion with Treasury, yes, we might have overstated, but in Q3 and Q4, we're looking to generate additional revenue. That line item was specifically speaking to additional revenue that we would look at. As the entity understands the pressures that the province is facing in terms of finances. So there's been a big drive in our funding strategy that we've developed over the last 2 quarters, and we're putting that into action at the moment. The other question with regards to Program 1 also speaks to the first question. Program 1 is the corporate services. We've moved into new premises in Durban Central, and we've incurred expenditure in terms of the work that needed to be done in the premises to get it up to the standard that we wanted. Hence the increase in that in Program 1 expenditure. Further to that, we have developed we have established a conference center within our current premises, which we will now hire out to government departments, a 200-seater conference center where meetings can be held and conferences or summits can be held instead of paying the exorbitant fees at an ICC, for instance, or any of the other locations in Durban. We've availed our premises for that. So we've incurred some expenditure to get the premises up to that standard. So in Q4, we'll go live with that. Currently, we are using the premises for conferences. We're using it for dissemination of information, seminars, and that is proving to be a hit as we are in KE Masinga Road, which is in central Durban. It also increases our visibility of the entity being central in Durban. With regards to the environments, we're currently busy with the environments at the moment. So by the end of by the end of next week, Treasury will have that. We have been in discussions with them yesterday around the environments, and that's what's needed to be looked at. If I could just look at the maritime assets. Currently, the assets have been reassessed. We looked at them again, and 2 boats are currently being prepared and handed over to the Sokula project in King Cetshwayo district. It will be used for the communal small-scale farmers. So we looked at all of the assets that we had, and those that we are able to remold and to use, we have donated those to the community. We're also preparing the maritime assets for disposal. It's something that was looked at the board, that the assets would be disposed of and the funds would be utilized within the entity. Furniture that we had from maritime is being donated to the TVET College. The TVET College is currently using those assets as it was stored there. So they've actually been making use of that. So the plan is to dispose of assets that are not in use, and we'll do that via an auction. I think maybe one of the other questions was Program 3, the spending pressures there. Program 3 is the development sector, and that's where the Masita funding goes through as well. So that's also where the digital center expenditures go through. So the digital centers, currently we are funding the operational expenses of the digital center, but in terms of the funding that we receive from the shareholder, it hasn't included the operational spending, expenditure. So when a digital center is set up, we receive funding for establishment, and thereafter the running costs come out of the entity. But since we've got to 17 digital centers and we've got a few more in the pipeline, it put a bit of pressure on us. So that's where we're looking at that. So there is a constant review or monitoring of expenditure within the entity. We try and make whatever rand that we have go as far as we can, noting the challenges that they are in requesting additional funding from the shareholder and the budget cuts that we've received as well. So there is tight and very close monitoring of expenditure at the entity. Chair, maybe the last question with regards to return on investment, maybe if I can hand over to our shareholder from Etia, Chair.
Thank you very much, CFO. Greetings once again, Chairperson and honorable members. Most of the research that is being done in the department by the operational programs, for example, Program 3 that deals with industry industry and trade. They actually utilize Moses Kotane to do that research. That also applies to integrated economic development services. That also is responsible for programs such as local economic development, economic empowerment, and so forth. So you'll find that in terms of the project selection and understanding what's happening in some of the areas that we operate, in the rural areas, in the townships, most of this research is actually underdone by MKRI. But what we also do, Honorable Chairperson, from time to time as we prepare cabinet documents as well as cabinet legislature documents, most of that information actually comes from the research that is being undertaken by MKRI. But we must also indicate that as a department, we also cooperate with, we collaborate with Moses Kotane Institute, particularly in terms of undertaking of research. So there are joint research programs because we have a research unit as well. So you'd find that some of the research that is actually being done is done jointly. And most of these research inputs or recommendations that are coming from this research, you then find it through cabinet or executive documents. We have what is called economic sectors, infrastructure, investment and employment cluster of cabinet, where the consolidation in terms of the research output that is coming from Moses Kotane Research Institute is then consolidated into the cluster plan, the medium-term development plan of cabinet, and all the interventions that you then see in the plan. Most of these are influenced by the research, either that is done by Moses Kotane Research Institute or done by the department or jointly done between the department and Moses Kotane Research Institute. So yes, in terms of the return of investment, usually research really is to influence policy and also to advise in terms of where investments should happen in the local economy. In other words, research is envisaged to indicate to the province where should we invest and what resources should we deploy to these regional economies, noting the spatial inequality or perennial underdevelopment that the province is facing. So it's usually very difficult to actually measure the return of investment, particularly given that research is not envisaged to actually make a profit. But what we can say, Chair, is that once the research is done, we then actually implement this research. But I can also point out a few examples, Chair, that what you note is that we also have what we call legacy projects that are actually being done once a research has been undertaken. A good example is in Greater Kokstad. There is a research or a strategy that was formulated in collaboration with the Greater Kokstad municipality. They had actually requested about 2 million for that research to be done, but the department then indicated that we could not make available 2 million just for the purpose of a research, but we then took 1.5 million of that to actually develop solar-powered boreholes in 2 communities in that part of the province. So you'd find that there is actually work or projects that are actually emanating out of the research that is actually being done by Moses Kotane Research Institute. Thank you very much, Chair and honorable members.
No, thank you so much, Honorable Nai.
Thanks, Chair, and thanks for the responses. So those assets that were donated to you, from what I'm understanding, and you can just provide clarity, you did not sell any of them so that you could get some revenue into the institute. You donated all of them. And then secondly, from all of the ideas that you mentioned, savings, ways of generating income through rental and so on. How much, what is the projection, and is it adequate to keep the Institute afloat and supplement your existing budget? And also, you didn't comment on the potential breach of the Labour Relations Act, the issue of staffing. If you could comment on that, I'd appreciate that. Thanks, Chair.
CFO? Oh, yes, Honourable de Klerk, my apologies.
Because it follows on this question. We've just heard, because it was asked by Honourable Nair regarding the research that's done and so on, and you mentioned that it's not a profit-making, which we all understand. But the question that arose immediately with me is it value for money? So I presume one can establish that quite easily to say there is X number of research papers that leaves the entity on a yearly basis. You've got 113 million budget. 60% of that will go for the researchers and salaries. That's 76 million rand a year. Will you be able to maybe today, I don't know, answer how many research papers goes out so that we can work out approximately how many million rand or how many rands does it cost per research paper that leaves? And then we'll be able to say, is it value for money or not?
CFO?
Thank you, Chair, and thank you to the honourable members. If we start with the assets, there's a hybrid method. We are donating some of the assets and we are auctioning some of them. So some of them, like the specialized equipment for divers that we currently donate, we will then dispose of that. So that's currently in the process. The furniture and equipment and the computers, those we are able to donate. So those are being donated. The funding strategy, we put together a funding strategy for the entity, which would include the revenue generation from rentals, from conferences. We have targeted 20% of our budget in the coming year as what we are targeting for our own internal generation of revenue. Part of that revenue generation is the submission of research papers for publication. So we are able to generate revenue when we submit our papers for publication. And once they are posted in a journal, we are then able to be funded by, I think it's one of the Department of Education, or I can't remember which department it is, but we submit the papers for review, and then they pay us a levy for every paper that we've submitted. So we've started that in the current year. We haven't done that in the past, but given the amount of work that we do in terms of research, we have a lot of research papers that have been done, that have been published in other journals outside of the country. We publish research papers in a lot of journals. Currently, we are busy working on our own MKRI journal, that we will have our own journal that we can publish so that we have other people publishing in our journal as well. So that's one of the largest portions of our budget that we're looking at to generate revenue from, because I think for each paper it's over 125,000 rand for each paper. So it's quite a large amount. Whereas the rental income, we're looking at 45,000 for a week to use the premises. So the papers is our real, that's where we're really going. The other option that we've done is, which we've generated revenue in the last 2 years, is to charge other departments for research done. So we charge them for the data collection portion of the research. So we've just invoiced Ezemvelo Wildlife for 450,000 rand for a research project survey that we had to do for them. We've done work for all of the Etia family as well. And we share the cost with them in that we don't charge them the full amount, but we charge for the actual data collection, which is the the transportation, the stipends, as well as accommodation. We recover on those. So each research costs around the region of 350,000. So for each research paper, it costs about 350,000 in terms of data collection and in terms of the time that we use if we use any independent contractors. So that gives us an idea of the income that we want to generate. When we sat at the board, the idea was that we would come out with 20 to 25%, even 30% of our budget that we generate internally. The COE, yes, I omitted to comment on that. We, in an ideal situation for MKRI, when we looked at our business plan, when we moved over as a Schedule 3C entity from being an NPC, the business plan that we presented, we haven't been able to fill that organogram because of budget restraints. And in that, we've had to have short-term contracts with independent contractors who work on specific research projects. So we'll have a contract for 1 or 2 projects, and then we'd look at another contract for another project. So that's how we've been able to manage the cost, in that we have a 43% vacancy rate within our entity on the ideal organogram that we've had. So we are lacking resources in terms of human resources and in terms of financial resources. But I think the brain resource that we have, or the brain skill that we have within the organization, we're able to manage that to achieve our APP targets still within the constraints that we've had as an entity. The Treasury did raise this matter with us in terms of the labor aspect of how we do that. So we're busy in consultation at the moment. So we will look into that. Like I said, our contracts are independent based in that they are based for a project specifically. And that's how we manage to get the expertise we need for certain projects. So I think that's the way, but we are looking into that with Treasury as well, Honourable Member.
No, thank you so much. I think that was very extensive in terms of responding. Thank you so much for appearing before us. And I'm sure you were surprised why you were called in this time around. Some of the time you have not been called. We are doing a number of monitoring, where we pick up that we are worried here, we are worried there. We do not call on all of the entities. So we decide which one we will call through. Otherwise, thank you so much for appearing here. Honourable members, we've come to the end of our meeting. What now happen is that we'll go and draft the resolutions. We'll then request members circulate it and then request comments, and then we'll convene, even if it's virtually, so that we can then approve or adopt those resolutions. You are invited for lunch here at the members' lounge. Is being served as we close the meeting. Thank you so much, honourable members. Yeah, thank you so much. The meeting is duly closed.